back to another episode of the Deals for Dentists podcast. I'm your host, Dr. Eric Block. And as always, I want to inspire, entertain, and educate you on the best tools and technologies out there. And my goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And be sure to check out my latest book, Stress-Free Dental Implants, Re-Energize Your Career with Implants, and also my first book, The Stress-Free Dentist. Also, check out my upcoming personal development retreat for dentists called Roses and Thorns at dentalgrowthcon.com. It'll be in Chicago on May 18th to May 20th, 2023. And it'll be a no BS, intense, but fun retreat where we dig into your top 5% and bottom 5% in your life and career. And we're all going to learn from each other's mistakes and failures. And it's all inclusive, so you just got to get yourself there. But enough about me. I want to talk about my friend here, superstar guest here, Dr. Ryan Morrison. Ryan, thank you so much for joining us.
Thanks, Eric. Great to be here.
Dr. Ryan Morrison is a 2010 graduate of Boston College, or BC, like we say here. People from Canada think that's British Columbia, but BC is Boston College, and a 2014 graduate of Creighton University School of Dentistry. He completed a residency in advanced general dentistry at Marquette University in 2015, and he now lives in Omaha, Nebraska, where he has a private practice, Millard Family Dentistry, and he's married to Betsy, and they have twins, Pia and Hayes. Awesome, man. So where are you actually zooming in from today?
I am on my lunch break. So I got in between patients. So I'm in my office at my clinic.
And is that in Omaha?
Yeah, somewhere in Omaha. Yep.
Awesome, man. That's great that you're able to join us during your lunch break.
Yeah.
But tell me all about you're an entrepreneur. You have an amazing software called Teamworks, which I use in my office. But and I want to get into that a bit later. But first, just tell me a little bit about your story and how you got into dentistry.
Yeah, thanks for having me, Eric. This is awesome. My microphone isn't as cool as yours, but got top 40 countdown with Eric Block. This is incredible.
I got to do something with this voice, so I need all the help I can get.
My story, I've like anybody, dentistry is a leap of faith in a way. You think that's your calling. You think it's going to be a good field to go into. For me, when I was looking at it, I saw the technology coming into dentistry, and I thought it was that really good combination of healthcare and technology, and that's even in dental school I really enjoyed kind of looking at new tech, and that's how I jumped in. It's and I thought it was a way to, you could still someday kind of be a business owner, own your own practice and kind of check some of those boxes that I wanted out of life, and that's why I chose it.
And now, were you after school, you graduated dental school and you did an AEGD? What was that year like? And would you say you would highly recommend doing at least a 1-year program after dental school?
That was so big for me. I didn't feel like I was quite ready at the end of dental school, and I wanted get a little more confidence. And so that's why I chose Marquette. And man, the culture up there was so great. And when we were at the AGD, we had our own clinic at the school, but we would also help the students in like the acute care and the emergency. And so I kind of got to do both. I got to the teacher wasn't really looking over me, and we had to present cases and stuff like that to our director, but it was kind of that great combination of autonomy, being able to get my speed up. We had private practice dentists that would come in and teach at the program, which was incredible, really helpful. But then I also got to teach, which was super cool, because like 1 or 2 days a week, you would help, like I said, in the acute care department or the emergency department. And it was a little strange. Like I just graduated a few months ago, but now I'm teaching, but it was still really enjoyable to kind of even work through the diagnosis or help out with an extraction. It was a great year, and I highly recommend it to anybody. Like it was really, really great.
Yeah, I actually, after dental school, I did a residency at BU. And then after I finished the residency, I went back and I taught a bit. And you actually learn so much when you teach.
Yeah,
you just
you
learn
really
so much
do.
from the students. And then how many years did you associate before you started your own practice?
It was about 4 to 5. So I graduated from Marquette residency, moved back to Omaha because I wanted to move back home, and I needed a job. And so I worked at a pretty large DSO to start with, and man, even doing the AGD, joining a DSO, like I still had a lot to learn, and I was there for a little bit, and then I joined kind of a smaller DSO, and then about 4 years into my associateship career, uh, I mean, it's almost kind of like a light switch. I woke up one day and I was like, you know what, I'm ready. Like I am ready to get my own practice, and it was an amazing feeling how quick it was. And that's when I really started looking, and found a practice to buy from an existing dentist, and started there. But I needed those 4 or 5 years to. You learn a lot about yourself when you're doing associate, what kind of practice you want, because that's really important. I think it's so important to know, what type of dentist you want to be. Can't be everything to everybody. And I think it's really important to choose. And I wanted to kind of take, the technology road. I really wanted to have really cool technology in the office, same big crowns, cone beam, but, and I wanted to do that. That was a big goal. But it took a lot of time to realize that. And like I said, I think learning a lot of leadership in dentistry, because they don't teach you that much in dental school about leadership or time management or business for that matter. And for me, it took several years to get that confidence as a dentist to diagnose, and get that confidence to manage staff. And I think it's important to be an associate for a while, because you learn how you want to be treated before you become that owner of what type of culture do you want in your practice. And I learned that by joining different dental companies, DSOs, of, I like what they do there, or I like what they do over here, and I'm going to take that for my practice. I like that bonus system. I might use that. But I think it took a while to do that. And I think you need to.
So it sounds like your experience working with or for a DSO was really positive.
It was, it was a roller coaster, like anything. I mean, when you're not making the decisions, it's different. But it was really good looking back, because I needed that, and I'm very lucky. Like I met great staff members along the way that followed me when I bought my own practice, which was really humbling, and it was really crucial to my development to do that. Yeah, overall it was really good, but it led me to realizing I'm ready to have my own.
I heard you mention the word confidence. Do you think that was really, of course, the clinical skills, picking up your speed and that, picking up your clinical skills, but you mentioned the word confidence. Did those 4 years, that AGD, and then those 4 years as an associate, did that really help you with your kind of your presentation to patients and how you deal with staff and confidence within yourself?
Yeah, man, big time. Being a dentist is hard. Being a young dentist is really hard. And
Yeah.
I can put myself back in my shoes when I was like a first year associate, and you see a cracked metal filling, the patient needs a crown, but you're just worried that they're going to be upset or in any way, or just frustrated that they're going to need this procedure. And, there were times when I was like, okay, maybe I guess I could do a MOD XYZ or whatever like that. And it took a while, but it's really getting to that point where this is what you need. I am confident that you need this. And then the staff will support you too, because it really does trickle down. If you have the confidence to support your dentistry in front of the patient, then the staff will have the confidence to support your dentistry. The front desk will have the confidence to support your dentistry. And it starts with you. Like, you have to show that and be that rock in the office to support each other, because the real conversations happen when we're not in the room, or they happen on the phone when we're in the back and they're at the front. And if you can support your staff and they come to work and they know that, hey, this dentist has my back, then they're going to support your dentistry. And I think it's really important to be able to do that. It took me a long time to do that.
Took me a long time as well. And I think that confidence is so important. If you're walking in there and you're presenting treatment plan and you're unsure, or you look unsure, then your patients are going to sense that, your staff's going to sense that. the more confident I got, and actually the less I cared about whether they followed through with treatment or not, actually the more treatment plan acceptance I was able to achieve because I
Yeah,
walked in there with that confidence.
I love that.
So I really think that, and I did a 2-year program after dental
Nice.
school. I think at least a 1, and then associating for a few years and finding out different types of practices and then molding that into your own, like you did, is a great way to go. Now, tell me about developing your company, Teamworks. How did that all happen?
So it was about a year and a half ago. We we started to look at what we were looking for my practice was I wanted a consistent visual patient education program to repeat the same message over and over. Because, like we said earlier, the real conversations happen when we're not in the room, and the patient has to hear it 5, sometimes a lot of times before they really understand what they need. And I didn't see it out there, and that's when we started to develop it. So we started to make 3D 4K type videos of dental procedures where you show the problem and then let Teamworks show the solution. And we call it Teamworks is because it's all about team and it's all about the workflow. And that's the staff has to support your dentistry. And you're only as strong as your least confident employee. And we wanted to provide a solution where hit play, and any staff member, whether at the front or the back, they have the ability to confidently show the patient what they need and why they need it. And we don't have the luxury of being a physician's office. If a patient calls in, you can't press 2 to talk to a nurse. If a patient calls, they're expecting to talk to somebody clinical. And we hear this all the time. Why do I need the deep cleaning? Why does my husband need the deep cleaning? Why can't I have a filling instead of a crown? And we wanted to provide, and even though the patient may seem like they're challenging you, I think they're really just trying to know, like, why. And we want to provide that visually. We live in a visual world with social media, and it's all about video content everywhere. And we wanted to bring that to dentistry.
Now, are these videos to be shown in the hygiene room, the dental chair, the treatment plan, the treatment plan room, or is it really for anywhere to show a patient?
Great question. We wanted to provide a touch point for any part of the journey. So chair side, 100%. Treatment coordinator room, 100%. We provide it for active subscribers. We provide the embed code so you can put videos on your website. And then we also provide a textable link. So if a patient needs to go home, talk to their significant other, we provide a link where you can put in your patient engagement software to text to them. So it really, we want our video and our content, Teamworks, to live anywhere where the patient is. Every point of the patient journey is really important to us.
And you have a broad range of videos, for example, hygiene, crowns, fillings, implants.
We go from hygiene all the way to specialized oral surgery. We have clear aligners. We have stages of gum disease, scaling and root planing. We have sinus lift. Our full arch is coming this week. We have crown. We have cavity, cracked tooth, implant, bone graft. We have 75 videos, and it's growing every day. And our average length is about 40 seconds. Our longest one is around a little over a minute because we show a root canal through a crown. Isn't that a fun thing to talk about when patient needs a crown? What do you mean? You got to take my crown off now? What the heck? Or how does this work? No, you can go through the crown and we can fix it. And so that's one of my favorite videos, actually, because that was always a tough thing to talk about. But we try to keep it quick, just shorter attention span. We know that. And we really want to give a journey to show the patient this is how it's going to be. And that will lower stress. And if you can make the patient feel that they have some control, patient acceptance, treatment acceptance is going to go up.
Yeah, and I think that a picture is worth 1,000 words, but a video is worth 10,000 words. I've gotten better. I've been practicing for 20 years, so I've gotten much better at explaining and knowing what key words to use to get patients to move forward with treatment. But as a young dentist, I was not good at that.
Right.
And I would explain procedures and have a difficult time. And I could just tell sometimes that patients weren't locking into what I was saying. So having a video there to show the patient, I think is so valuable.
Couldn't agree more. And we have reporting that comes along with Teamworks, where you could see which staff member is playing which videos. We're even adding a leaderboard, so you can see who's playing the most videos. We're really trying to make it a fun thing to do, because it should be. Talking about treatment, you can solve the patient's problem, and you should be able to involve that patient on their journey. And there's no better way to feel like they're involved than a picture. You're exactly right, Eric.
Yeah. And, by the end of the day, I'm exhausted, and having to explain the same procedure over and over and over again, it's tiring, and I'm probably not going to do as good of a job as I did at 8 a.m. So what better than to pop on a video and, have the patient watch it, or if it's in the hygiene room, put the video on while the hygienist is going to get the doctor for the exam. There's so many ways you can use it to help you in your practice, correct?
Yeah, 100%. It's time and energy, like you've said. It is, talking about treatment, like, what is this crack that you have to fix? You're talking, stop talking, start showing. And the workflow is important to us because we built a Chrome extension that is a one-click access to the library. And because at the end of the day, we all know you can put the best product into the workflow. If it is not easy to use, if there's a separate login and they got to click 10 times to get somewhere, it's not going to get used. And the Chrome extension was important to us because it is a direct link to the library of our videos all day.
So you make it easy and simple to click on it. Now, I think this would be really beneficial, for anyone, but especially young dentists, or let's say a new dentist to a practice, or a new hygienist to a practice, or a temp that's coming in that doesn't really know the system, or doesn't really know the patients, or let's say even a English as a second language patient or provider. I mean, it's so different trying to explain something than just showing them a video.
Yep, that's exactly right. And one thing I've realized is, that wall between the front and the back is still tall. Getting the front and the back on the same page is so key. I mean, even the wording, Eric, if you tell a patient in the back they need scaling and root planing, and then the front desk says deep cleaning, the patient's like, wait, am I getting what's scaling? Is this like, you got to have the same wording. And so that's why this standardizes, and this provides a consistent message everywhere.
Now, what about your own practice? What kind of technology do you use? You mentioned before we were talking about a laser. Do you also have other technologies like cone beam or same day dentistry?
Yep. So we do a lot of cone beam, so we use a lot of CBCT. We really like our same day crown. I mean, that's just the future, and that is where it's going. And it's incredibly helpful because we do try to take there's a retail-esque experience, because you want to be quick and you want to be fast, but you want to provide the same level of quality. And so we really enjoyed our same day crown mill. That's been awesome for us. And we like the soft tissue laser. I've been doing a lot of that recently, even just helping on deeper crown margins. That's one thing because we use that 4212 code a lot. If there's that, we got to just kind of do a little gingivectomy below the gum line, and that has been nice. And you can really see the margin so beautifully when you're designing the crown. So we put that in about a year or so ago. Really enjoyed that.
And what same day crown system do you have?
I use the Glidewell Fast Mill.
Mm-hmm.
It's really nice. It's just pre-sintered zirconia. We don't have to use an oven. We usually get a crown done in about like an hour or so. It's pretty good.
Yeah, that's great. You don't have to deal with the temporary or rebooking the patient. That is so nice. And it seems like it's a lot more fun too, to be able to do it the same day.
It's really fun. And patients have come in and watched it getting milled before. It's they really want to know, which is exactly kind of why we had Teamworks, because they want to know what the procedure is. How are you doing this? This is so cool. And that's been a big thing of us, is really explaining what the same day crown procedure is. And it's nice that, I say we bought it from a lab, so it's like a lab quality, and that's been great. And I'm just a big fan of zirconia. It's such an awesome material.
Yeah, me too. Okay. 3-part final question.
Yes.
And I can repeat these if needed. Number one is, how do we find out more about Teamworks? Number 2 is any advice for young dental professionals out there? And the third one is advice for young entrepreneurs. So let's start with how do we find out more about Teamworks?
So you go to teamworksdental.com, and that's with an X, WORX, so teamworksdental.com. You can make a free account. We give 4 free videos away for your free account. You can also see 10 seconds of all the other videos before you pay for it. And because we wanted to provide a true experience to go make an account on your own and have fun and see what it can do. And so that's the first one. What was the second question, Eric?
Advice for a young dental professional.
Oh yeah. If I could, if I can go back and tell myself, it's really kind of look in yourself and see what type of dentist you want to be. Like, and really find your niche in a way. Like, are you good at root canals? Are you interested in sleep apnea? I think it's important on finding kind of what excites you in dentistry. And for me, it was, technology and same day crowns. Like, I love that kind of stuff. And like, I'm not good at molar endo. I don't really do it. It's early on, I thought, I got to do all procedures, right? That's not true. It's not true. Like, really focus early on what you like and what you feel like you're good at. And that's something I wish I would have I could tell myself early on.
Yeah, I think also to figure out what you enjoy.
Yeah.
And also to stay in your comfort zone, to
Yes.
not
Well put.
get into trouble and go out of your zone and take on patients or procedures that you may not be comfortable with. Okay, final question. You're a dentist, you're an entrepreneur. What advice would you give for young entrepreneurs out there?
Don't be afraid of failure. But I would say fail fast as well. If you really feel like something's not working, don't try to keep digging and trying to get out. But I look back at like failures I've had and even like dentistry or like being an entrepreneur, and it's brutal in the moment, but looking back, it really makes you way strong, and you learn so much. What do they say? Success is a horrible teacher. Like, it's and so that's where, and from like a dental entrepreneur, and really like just jump. If you're fourth year dental student or even like a year out, give it a few more years as an associate. It is what you will learn is so incredible, and those DSOs have a lot to teach. I mean, they're good. They're really good at running a business, and I learned a ton from them. And I have friends that still work there, and it's great. But for me, it was when you get to learn what products you like, because there's a ton of different bonding systems. I mean, it's really important to learn your style of dentistry for those first few years. But that's what I would say.
When you said fail fast, that in entrepreneurship, I think that is such an important lesson. And entrepreneurship is this strange business where failure is actually like a badge of honor. When you fail, it's actually seen as you tried, you stepped into the arena. Now let's move on and learn from those mistakes. So I think you're spot on with that. Dr. Ryan Morrison, thank you so much for joining us, and I look forward to being in touch with you.
Eric, thank you so much.
Take care.
Bye.